It all started off when I was maybe 4 years of age. My sensibilities did not allow me to fully understand what was happening. They casually told my mother and my father, have another baby, maybe it'll be a boy. Was I not sufficient? Was I not enough? Was I worthless? That thought often kept me awake at night, and I promised myself that someday I will be a woman who was a force to be reckoned with. And well, maybe to the disappointment of my so-called well-wishers, that is exactly what I'm proud to say happened. You see, while I was doing my bachelor's, I met Dr. Natasha. Dr. Natasha was a very promising young woman. She wanted to become a doctor purely because she wanted to save lives. And she wanted to do so just so that she could raise her head high and say that yes, she was a female doctor. Unfortunately, right after her graduation, she was forced to get married. Within a year, she had a child. Who was to blame, the society or her own family, that caused her to actually go through maternal depression? In Pakistan, nearly 60,000 female doctors graduate every year, but barely 23% ever register or work. The rest disappeared. Interestingly, this does not just affect Dr. Natasha and other doctor brides such as her. This also affects all the women living in rural, marginalized communities such as Hina. Hina lives in a beautiful northern province. But because of lack of access to a healthcare physician, she has had 7 miscarriages and 2 stillbirths. Unfortunately, in Pakistan, more than 50% of the population does not have access to healthcare. Even today, 7% of the children do not get to see their 5th birthday. 23% of women still give birth at home. And Pakistan is not ranked very well on the health index. So what does one do exactly? Is there anything that one can do? Interestingly, we live in the technological era. You see, in our era where technology is rampant, where we see how widespread it is, there are no borders, it can really bring about a change. It can bring about a very simple solution to a very complex problem. And that is exactly what WHO states. WHO states that around the globe, more than 400 billion people do not get access to healthcare. But by 2022, because of telehealth, more than 12 billion people will be able to access healthcare. Now, given that's the case, what do you think will happen to Pakistan? Do you think that if I use this simple notion, Pakistan can actually have a way better health index in the future? And this is exactly why and how started Sehat Kahani. Early on, I met Dr. Sara and Dr. Ifat. They both were very passionate. They both were also doctor brides who had gone through the same phenomenon of having to choose between their career and their families. And that is when started a journey for which we were discouraged, we were questioned, we were told we were mere girls who were just going to have kids and give up on their hopes. But no, that is not what was going to happen. Today, we connect home-based qualified female physicians to marginalized communities through e-health clinics, and we connect upper and middle income communities to female doctors through an e-health application model. In low-income communities, we connect with a nurse, we upgrade her facility, we ensure that we build her capacity and provide her the skills required to run a standardized clinic. Today, in these clinics, no longer do patients walk in to see a broken infrastructure, but rather a standardized clinic. Today, when they walk in, it is not a quack who treats them, but rather a qualified female physician. They don't just get treated, but they also know how and why their mental health is important. When we talk about the upper middle income or the middle income class or people like you and me, we basically have an application. You see, often I would ignore my own health because, work was more important, family was more important, friends were more important. But now, just in that little 15-minute slot that I can get out for myself any time of the day, I can easily connect to a doctor. And not just every doctor and any doctor, but I can also connect from a general physician to a specialist, to a psychiatrist and a counselor as well. Today I can proudly say that something that started as a very small dream a dream that many were not sure we would fulfill, a dream which I myself was not sure where it will head. But today that dream has affected more than 1 million lives. Imagine 1 million lives. We have 25 clinics. We've impacted more than 800,000 females alone with the help of 1,500 female doctors. Imagine if only one is willing to dream. What can one do? Today, I can proudly say that our virtual doctor, who was supposed to be a doctor bride, has treated patients in a mental asylum where for 8 years there was no psychiatrist. She has allowed a woman to have a child after 16 years of infertility and I don't know how many miscarriages. She has ensured that a 16-year-old was saved only because she got the right diagnosis at the right time. She has never met them, but she has ensured that they are happy and healthy. Today, I, Makia Javed, am proud to say that I was willing to dream, that I promised myself to be a force to reckon with, that I am no longer the little girl who was lost, who did not know about her own existence. Today, I know for a fact that I am a woman who believes in herself, who has chosen a partner who is not so conventional and supports her dreams. Today, I'm a woman whose parents are proud of her. The same well-wishers today congratulate them. Today, I have not just won numerous awards from the World Bank, UN agencies and have been recognized by media channels and many others. But today, all of this sometimes pales in comparison when a nurse calls me and tells me, her child knows technology because of us. Or a doctor calls me and tells me, she no longer feels alone. Or a patient simply prays for me. And this all is what I always envisioned would happen. Imagine if a small miracle like Sehat Kahani can change the healthcare ecosystem to such an extent. What can a little more miracle do? Imagine if 3 women coming together can change the ecosystem in ways where female doctors are integrated back into the workforce. What can all of you do? Someday, I believe that Pakistan will be ranked as the top 10 countries when it comes to the health index. Someday, I believe that everyone will have access to a doctor regardless of their social standing, class or creed. Someday, there will be no doctor brides because we will make sure that does not happen. Today, I know that on my deathbed, I will know that I have played my part in ensuring that women are no longer held back by the shackles of society. Will you?